A stroke occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Early recognition of a stroke is crucial, as prompt treatment can minimize brain damage and increase the chances of recovery. Here are key warning signs to look out for. Number 1, sudden numbness or weakness in the face, arm, or leg. One of the most common warning signs of a stroke is sudden numbness or weakness, especially on one side of the body. This may manifest as a drooping face or inability to raise one arm, or a feeling of heaviness or weakness in a leg. If you notice these symptoms, especially if they occur suddenly and affect one side, it's essential to seek emergency medical attention immediately. Number 2, confusion or trouble speaking. A stroke can affect the brain's language centers, leading to sudden confusion, trouble speaking, or difficulty understanding speech. This can include slurred speech, an inability to form coherent sentences, or difficulty comprehending what others are saying. If someone suddenly starts speaking nonsensically or has trouble finding words, it may be a sign of a stroke. Number 3, sudden vision problems. A stroke can cause sudden changes in vision, such as blurred vision, double vision, or loss of vision in one or both eyes. These changes may come on suddenly and may only affect one eye or one side of the visual field. Any sudden, unexplained vision problems should be taken seriously and assessed by a medical professional immediately. Number 4, difficulty walking or loss of balance. A stroke can affect coordination and balance, leading to dizziness, difficulty walking, or a sudden loss of balance or coordination. This may result in unsteadiness or a feeling of vertigo, or difficulty performing movements that are usually simple, like standing up from a chair or walking in a straight line. Number 5, severe headache. A sudden severe headache that comes on quickly and feels different from a typical headache or migraine may be a warning sign of a stroke, especially if it is accompanied by other symptoms like vomiting, dizziness, or altered consciousness. This type of headache is often described as the worst headache of your life and may indicate a stroke where a blood vessel in the brain bursts. Number 6, tingling sensation. Sudden numbness or tingling, especially on one side of the body, can be a sign of a stroke. This sensation can affect the face, arms, legs, or any other part of the body. The sensation may come on suddenly and be accompanied by weakness or paralysis. Number 7, drooping face or asymmetrical smile. A stroke can cause one side of the face to droop or become numb, resulting in an asymmetrical smile when the person tries to smile or speak. You can perform a simple test by asking the person to smile. If one side of the face droops or doesn't move, it may indicate a stroke. Number 8, trouble swallowing. A stroke can affect the muscles involved in swallowing, leading to a difficulty or pain when trying to swallow, also known as dysphagia. This symptom can cause choking or coughing when eating or drinking and may be accompanied by drooling. Difficulty swallowing should be treated urgently, especially if it occurs suddenly. Number 9, sudden behavioral or mood changes. Changes in mood, behavior, or personality can sometimes signal a stroke, particularly if they occur suddenly. This may include irritability, sudden aggression, confusion, or a lack of awareness of one's surroundings. These changes are due to the stroke's impact on the areas of the brain that control emotions and behavior. Number 10, sudden loss of consciousness or fainting. A stroke can cause a sudden loss of consciousness, fainting, or seizures in some cases. If someone suddenly collapses or becomes unresponsive, it could be due to a stroke or another medical emergency, and immediate medical attention is required. Recognizing the early signs of a stroke can be life-saving. Symptoms like sudden numbness or weakness, confusion or trouble speaking, vision problems, difficulty walking, severe headaches, numbness or tingling, facial drooping, trouble swallowing, sudden behavioral changes, and a loss of consciousness are all critical signs that require immediate medical intervention. The acronym FAST, face, drooping, arm, weakness, speech, difficulty, time to call emergency service, is an easy way to remember the most common stroke symptoms. Time is of the essence. The quicker a stroke is recognized and treated, the better chances of recovery and minimizing long-term damage.